Heaven is shining down rays of gold. Cover me with your light, take me home.
Hello, everyone, to episode 6 of ND and ABA with Martin and Dan. I'm your host, Martin. Alongside is my co-host, Dan. Dan, how are you today?
I'm doing wonderful and feeling great. I've got my coffee here in my behavior analyst cup, and I'm ready to talk shop with some wonderful guests. We've got Erica and Brice. Erica from Psychologist BCBAs and Brice, the ABA unicorn on Instagram. If you guys don't follow them already, they are experts in what we want to talk about today, which are best practices in behavior analysis, and we're also going to do a little bit of a discussion on what Assent-based treatment looks like and how that goes. We're lucky to have Erica. She's a clinical psychologist as well as a BCBA, and we're also very excited to have Brice, who, like myself, is a very passionate behavior analyst who went, as dedicated as she could and as fast as she got her BCBA and is now spreading behavior analysis around the area of Colorado and well beyond. As you know, I'm out here in Hawaii and I'm already a big fan of Brice. So welcome, Brice. Welcome, Erica.
Happy to be here.
Welcome.
Thanks.
Thank you.
Alrighty, so before we dive in today, I really want to highlight something special that just happened. Today is April 20th and the grand opening of Martin's wonderful sensory room out in Morgan Hill. Martin,
Yep.
did you talk about that real quick?
Yeah, no, it's exciting. It was, there's words can't describe how awesome it was. I'm part of the Corazone Care advisory board, and it took a little while, if I remember right, to find an area to host. And after we got the approval from Morgan Hill, we gathered up enough material, and I think either somewhere over here or there, I will post some photos of the play area. There was a pretty good turnout too, and everybody loved it. And another exciting thing that I can scratch off the list that has happened, and it's honestly, I'm excited to see what comes of this, like if we're able to expand into other places as well.
All right, well, pat yourself on the back, Martin. Anybody who went out to the sensory room to see the grand opening out in Morgan Hill, pat yourself on the back. And anyone listening, thank you so much for being here. We really appreciate you guys dedicating time on your weekend or your commute to work to learn more about the field and how we can all move forward into the best practices for the most caring environment that supports the ones we care about. Before we all start crying real quick, I'm going to go ahead and ask a few questions. Really quickly, Erica, would you mind giving us, from what you understand, is the definition of assent, just so our audience understands what we're talking about?
Yeah, absolutely. So whenever I think about assent, most of the time when I'm thinking about these things, I'm coming from the psych perspective as well as the behavior analytic perspective, but I kind of draw my definition from the psych world. So when we talk about assent, we can't really talk about assent unless we're talking about consent, right? Consent really just referring to, we want to present that information about services, about what we're able to do, what we're capable of doing, risks and benefits, what are the outcomes, and then we just really want to make sure the individual understands. Now, when we discuss assent, there's sort of an assumption that that individual may not have the quote unquote capacity or ability to be able to communicate what we kind of refer to as informed consent. So we're more so kind of talking about if someone is unable for whatever reason to give that informed consent, are they willing to participate? So that's really kind of where I take that definition from.
Absolutely. I'm glad you kind of brought in that characteristic of informed consent or even informed assent, which is something that we are looking for in our learners. It also can be looked for in the families as well, but it's important to think of who is the subject of this programming and how is it affecting them? Do they exhibit characteristics that they are happy, relaxed, engaged in the concept of HRE, but also do they seem as though they approve and affirm of what is going on? If somebody, I'll give you an example, if somebody is screaming at the top of their lungs, crying, putting their hand over their eyes, head on the desk, running clear away from you, or trying to fight you off, all of these things are body language that express that assent. ASS, by the way, not ASC for those of you playing Wordle. ASS, you cannot assume that they have consent. There is no assent when you see those behaviors. It has been withdrawn as soon as you can clearly tell somebody is not happy, relaxed, engaged, or approving of the interaction you're having with them. I'm really glad that we have the sort of psych perspective along with the behavior analytic perspective, because as you say on your Instagram, and Lauren as well, I don't want to leave her out. By the way, we're sorry we couldn't have Lauren join us because me and Martin, we should have communicated the time zone to her actually, and we accidentally missed having her. But luckily, we were able to catch Erica. Erica, what you had said was, can psychology and behavior analysis be friends again? And again, that's why I'm really glad to have somebody with both backgrounds here on the show to kind of talk about where Assent fits into that. How do you think that moving forward, maybe applied behavior analysis can work with the psychology academic atmosphere to promote a better field going forward?
For sure. That is one of my favorite questions in the whole wide world. So as some of you who kind of follow us know, Lauren and I, we're both trained as school psychologists. So we met in graduate school at Illinois State several years ago, close to 15 years ago. And we sort of started on our journeys for clinical psych, school psych, and behavior analysis kind of all at the same time. So in that journey, what we were really seeing is when we started to interact with other folks who were trained in traditional ABA programs, we were not, but folks that were, there oftentimes were really lost opportunities. And as a lot of you may know, kind of psychology and ABA sort of had what we describe as this breakup during the cognitive revolution in the 1960s. And due to that, there have been a lot of ways that quote unquote traditional ABA has sort of regarded psychology. I think there's a little bit of bad blood there, a little bit of kind of tiptoeing around certain subjects. But when we look at a lot of the things that the two of you, Martin and Daniel, talk about, and you as well, Brice, a lot of the things you discuss address this. Some of the major conflicts and the major criticisms of applied behavior analysis right now, we've already got a really good guidebook going on in the field of psychology. When we talk about trauma-informed care, when we talk about cultural responsiveness, legal and ethical issues, and within legal and ethical, assent is right in there. We in psychology don't really word assent as optional. We actually have to document assent in our APA code of ethics. So our perspective and kind of what we're hoping to put out there just into the ether is that, reconciliation could be and should be possible. And that's kind of the topic of a book that we've got coming out later this year, Psych Essentials for Behavior Analysis.
Exactly. And you know what? I dropped my coffee there for a reason, and luckily it was almost finished, so please don't worry about it. I'm actually more worried about the cup because I love my custom behavior analysis mug so much. I'll have to glue it together, potentially. Let me just double check. Nope, it's fine. It's all together. Don't worry, guys.
Yay!
It's okay. But what's not okay currently, and what we want to be okay, is the relationship between psychology and behavior analysis. If those of you guys who have learned about psychology in your classes experience this as well, please, let us know. And, please, even hit us up if you're students. We'd like to have you guys on the show too. We want to hear your perspective. We want to educate people on what people are learning nowadays. But if you're in your class and you're in Psychology 101 at University of XYZ, and somebody is saying, okay, so there's the 7 different trees of psychology, and what are we going to study today? Here's behaviorism. Okay, behaviorism is highly critiqued by all the other fields of psychology, the psychodynamic, the analytic fields, the Gestalt fields, really all the fields are highly critical of behaviorism. And unfortunately, they don't give us enough credit because we're really founded in what is called radical behaviorism now, which it actually cares to consider what is the internal process that's going on. But at a start, behaviorism started out getting a lot of credit by basically excluding that variable, if we'll say it like that. And that's why psychology and ABA kind of have this divide in between them. Nowadays, we all know that every person we're working with is clearly having very meaningful internal events that affect their behavior, and those are behaviors in themselves. Oftentimes, in the past, we might think of latency as just a part of someone's behavior, when in reality, there could be entire behavioral chains occurring mentally. Our cognitive psychology friends, they know this as well. And, cognitive psychology and behavior analysis happen to be actually very similar in a lot of ways, except for the fact that cognitive psychology really takes into account how your beliefs affect your behavior as well. And if you believe something, the point is that as soon as something triggers you to think about that belief, is going to change your motivating operants for your behavior. And all the fields of psychology and can really work together. Behaviorism is simply one of them. They all honor the scientific method. And if we're able to maybe come together like this, have a great discussion, and hash these things out in a public sphere, I have high hopes for us as multiple fields to come together in service for, again, the ones that we care about: autistic people, neurodiverse people, people in need of simple health care as well, and anybody who could benefit from behavioral principles supporting them. Really, it doesn't have to be limited to autistic people like we discussed last time. Can be anybody. There's lots of scenarios with older people as well. I'm going to turn it over to you, Brice, for a discussion of maybe how this applies in a practical sense. But I know we work in a multidisciplinary environment in ABA, and perhaps that's another reason why having Assent when we work in these conditions is very important, though there's boundaries between disciplines. I'm wondering, from your perspective, how does it generally play out implementing an Assent-based treatment or model assessment, or whatever your experience is in practice with the clients you serve, and perhaps how does it play out when you're collaborating with other professionals?
Yeah, that's a really great question. And I love that we're having this conversation because I personally love to collaborate. I'm a very strong believer that I don't know everything, just like many people. And really, there's a lot of value in bringing in all of these other disciplines into better serving our client. But for me personally, as a clinician, what I like to do is I like to get to know my learner and I like to see where their boundaries are because I think that's very important, just like with our BIPs and intervention plans, treatment plans, whatnot. It's different for every learner, and every learner's form of assent is going to look different. And I also like to heavily consider my scope of practice as an analyst, and then also bring in other, disciplines in to help me further identify where my scope ends and maybe where their scope starts to continue, and where we can also learn, what the learner's assent looks like. And also, we can even include whoever's responsible for the learner. So if the learner isn't able to if they're younger than 18, whatever that looks like, if they have a caretaker, whatever their situation is, there's a lot of value in involving caretakers because they know their learner the best, right? Even more so than we do. We all know our family members the best because we hang out with them every day. So I guess that's a very broad answer, and I can go into more specifics if you need me to, but that's kind of how I start, without going into a very, very long summary of all the things that I tried to do.
You know what? That's wonderful that you brought that up, how important family members and caregivers are in the situation. It's also wonderful that we consider what is the age of this individual. Not that any individual at any age cannot withdraw assent, but perhaps a individual is old enough to decide for themselves on a lot of different things, and we should turn to them as a default to see what is their response to the schedule or the interaction we're having with them, especially within ABA. Though it's important, again, I like how you brought in the caregivers because there are boundaries in our field that extend outside of the scope of practice of applied behavior analysis. Many of those being medical boundaries because we are not medical physicians as BCBAs. We are simply highly disciplined in a specific field of psychology that is able to provide a medically necessary service prescribed by medical physicians. So in a lot of ways, when it goes to the physician that becomes outside of our scope of practice, is a great time to refer or recommend to the caregiver who to speak to about a certain condition where not that Assent is going to be impossible, but it may be difficult to tell whether this person can give Assent. For instance, if they're unconscious under anesthesia, how are we to know, right? In that sense, there's legally guidelines where your next of kin, your guardian, makes the power of attorney decisions for you when really, I guess, in some scenarios, it can't be possible to give assent or consent because you're unconscious or unable to breathe or potentially unable to move. Any number of things could really come into play there. So I'm really glad you brought that up. And, it's important to find where to start. Every learner is different. Their assent looks different. And it's really important as an analyst to go in and have an assessment that shows where should that line be drawn, where we should really not be crossing for the sake of dignity, and that we won't cross. If it were to be crossed, it would have to be by somebody like an emergency professional who has a skill set outside of the scope of practice we perform in. Alrighty, so that's a little bit wordy, but Martin, I know that you can kind of help us out here because you do a lot of good services out there in the Bay Area, and you performing services with clients through the model of ABA while allowing them to have assent is really inspiring to me personally as a BCBA. And I want everyone to know that you don't have to be within an assent-based model to honor and consider somebody's assent. In fact, if you are in ABA and you are thinking about these things, you can generally make a much more respectful best practice programming method for the individual you're working with if you know when they have withdrawn assent, when they're not going to be happy and they're not going to be able to tell you about it, and you plan accordingly. So I wonder if maybe you have some examples, Martin. I hate to put you on the spot, but perhaps maybe even just hypothetical scenarios might help here.
Wow, I'll go hypothetical. So let's say I have a nonverbal client, and depending on how they communicate, whether it be with like vocal stems or something like that, I can tell when they don't approve what I want to try, and when they do approve, I mean, sometimes, let's just say hypothetically, they do like a high pitched noise. That's the way that my brain works, being autistic and everything. It's a sign to my brain like, okay, doesn't want to do that. And if it was more of like a more calmer, more moderate tone, I'll be like, okay, so let's just give it a shot. And if they don't like it, totally fine. If they do, we keep it going. Something like that. I'm hoping that's what.
You know what? That's a perfect example, actually, Martin.
Okay.
For those of you guys who got your dictionaries out at the start of the episode too, if you look up assent, ASS, by the way, ASSENT, it's actually there to describe potentially verbal interactions as well. Though legally it's there to serve as a placeholder for when we can't use verbal interactions to identify consent. The definition in the dictionary actually gives an example that somebody grunted with assent at what was going on, essentially. So if you can imagine, you can grunt with assent, but you can really do any behavior with assent. And this is the new field of applied behavior analysis, where now we acknowledge behavior is communication, and any behavior with communicative intent is there to show us if there is assent or not. For instance, when you get the Wiimote thrown at your head, your assent is gone from that person. They are not giving assent to you anymore. They just threw a Wiimote at your head. How clearer could they be? How much clearer could they be? Their assent is gone. And you know what? I'm sorry if you got hit in the head with a Wiimote, but if you doing something that was against this person's assent, I'm not saying that you had it coming, but I am saying that you should have known better. You possibly also should have gotten out of the way faster. Um, and you know what? Pat yourself on the back for being there for that person. If you got hit in the head with the Wiimote and you're still there and you understood and you're understanding and you're going back at times that, oh, maybe that thing before was maybe not what they wanted and this is why this happened. It's not in spite of me, but this Wiimote was communicative intent and I just didn't see at the time. Pat yourself on the back and the head and get an ice pack and then go back tomorrow and say, I'm sorry, you know what? And next time we're going to talk about it differently. Have that debrief and say, next time, if we're mad and we don't like this, I will know, and you can tell me, you can tap me, you can try to show, what will you be responsive to if the learner does not speak. But in reality, it's important to have that debrief, whether you got hit in the head or not, right? If you can tell that assent was withdrawn, wait a day, wait an hour, wait as long as it takes for the learner to be de-escalated, and then just talk about it and perhaps apologize. One of the best things you can do to show empathy, validate someone's emotion, start that de-escalation, is at first apologize, because that shows that what they saw and felt was valid.
I do have one thing that could be a theory, but maybe some, like, those nonverbal have a tough time giving assent because their brain wants to, but they have a tough time because, like, I think if I said in the last episode where,
I know what you're talking about, where we're talking
with
about
meltdowns.
Meltdowns, yeah.
Yeah, so like meltdowns happen because for some of us, and from what I've observed, is we have a tough time conveying what our brains are thinking. And so I'm wondering, maybe sometimes some are not able to give assent because of that, which is why all these meltdowns are happening, which is potentially why what I just lost my train of thought there.
Maybe why it's important to be a caregiver and be there for that person, right?
Right, more like why some aren't able to give assent as easy as others are able to.
Absolutely. And, I'm going to go to your song again. I love your song, Martin. Celestial Radiance, Martin the Wolf. And
Danny Fathom, yep.
The lyrics are, cover me with your rays of gold, essentially meaning that, caregivers are there, oftentimes when we're lost in the dark to take us home, right? And we're in a situation, and you don't have to be autistic to experience this, where you're so upset that you can't give consent for someone to help you, or you assent for someone to help you. I'll give an example. There was a car accident downstairs from my building. I'll let you guys see my window for a second. I'm 16 stories up, so I'm watching this all the way up here, and I wanted to rush down and help. Unfortunately, I wouldn't have gotten there in time because it was cleared up very quickly. This person got hit by a car, and they're on the ground. And it seems like, since they got knocked off their moped by getting hit by the car, that maybe there's a spinal injury. And of course, this person's panicking, but everyone around them knows, don't get up, because you could hurt your spine more and become paralyzed. And so everybody in Hawaii is very, has the kuleana to help this man. And rather than helping him up right away, like 10 or 12 people come and they hold this man down. They hold him down, so he can't move his neck, and that nobody's going to hit him with the cars, and that everybody's, got the first responders on the scene, and they're able to help this person. And in reality, he was freaking out. He was like, oh my gosh, get the heck off of me, guys. I could tell from 16 stories up. I was like, whoa, this is very intense. And, I really hope that he doesn't hurt his spine because these guys are barely going to be able to hold him down. And then the paramedics got there. Luckily, the guy was able to get up eventually and everything was okay. He actually didn't have a spinal injury, but he was very panicked. In that scenario, though, I'm sure in hindsight, he may actually have appreciated that the people made sure that he did not immediately get up in a panic and risk injuring his spine until the paramedics got there to tell him, what was safe and check him out. My point being that he was not able to give consent or assent, and it's because he was panicked from a very traumatic instance. If something like that happens to you, it doesn't matter if you're speaking or non-speaking. It's important to have your caregivers or people around who are there to respond to emergencies, and generally in any scenario where you would be following, let's say, the Good Samaritan law, like a CPR scenario, it's okay for those things outside of the scope of behavior analysis to involve assent and consent being assumed for that moment. Though, when we're back inside the scope of behavior analysis, when we're in our session in our controlled environment in a safe, happy, relaxed, engaged state, at all those times, all of them should assent be considered. Okay? Unless there's an emergency and there's no other way, and it's really an emergency where this person can't advocate for themselves. It's not an emergency where you think that this is best. Assent should always, for context of applied behavior analysis, always be considered. Does anybody else have anything to say on that note? I know it was quite a hot take, quite generalist, but I stand by it. I'm willing to open myself up to criticism.
I have a thought that came to my mind just as you were saying that, Daniel, just about, first off to Brice, you said something really cool before about conceptualizing assent as boundaries. And I thought that was such a cool idea, because we're not just talking about, sometimes when people hear the word boundary, they think pushing out, when it actually is an invitation in. And I think that is such an important thing to remember with assent as well. But to your point, Daniel, too, I think that without knowing, you gave the example just now of you should always be checking in about that assent and evaluating that assent. And you should particularly ensure that you are not doing something just because you think you know better, because right there, you're tapping into the power dynamic that is inherent between technician, client, learner, individual, and or behavior analyst and individual. There's that power dynamic that exists there. It's between, a parent and a child, between a therapist and a client as well. But you can't know that about yourself unless you really know your values, your biases, your attitude. So I think that, Daniel, really circles back to a point you made previously about kind of the cognitive model and beliefs and ideas and attitudes and bias. So a lot of things with assent, you have to make consent and assent part of your value system as a clinician, because we are serving individuals. Like, we are here to help them be safe, engaged, relaxed, happy. Like, that is why we are here. So that was just one thing I thought, Daniel.
Yes, absolutely, Erica. That's so spot on. And you know what? It's just like what I say all the time to people that, it's not like the field of ABA cannot be used for good and only good if you make sure that your values of what you're implementing are never really breached, and I mean your ethical values. That's what the ethics code is there to produce for the field of ABA. And without it, of course, we would be subject to that dark history that, very well warrants the field of psychology breaking up with behavior analysis and behaviorism. Very well warrants it. Without the ethics code, they probably should have done just before that. You know what I mean? But to be honest, with the ethical code of conduct, if it is honored in the way that it's meant to be, and it is enforced in the way that it's meant to be enforced, which is to make sure that best practices are being implemented that honor, dignity, and respect, then we as a field, can use our values to create a harmless approach to helping those we care about. And I say harmless because we all take that Hippocratic oath when we start the field as clinicians in some way or another. Maybe it was your 40-hour training, maybe it was your graduate program, maybe it was something else. But you've all been there. And I think you've all seen that slide where it said, you're a clinician now, and you, where's my camera, are under the Hippocratic oath. And Hippocrates said, do no harm. You got it? And without Hippocrates, there's no medicine. Okay? So you got to give him that. By the way, shout out to Da Vinci for inventing anatomy. And I wanted to shout out Da Vinci because you guys know my organization, Da Vinci NCR Services. My real mission and values aligned with that mission of creating Da Vinci was to pilot a Assent-based model that aligns with the values of the neurodiverse community and perhaps puts an end to this fixation on compliance with the method we all know and love, non-contingent reinforcement, which is proven to be able to be used to both reduce extinction bursts, reduce undesirable, and limiting behaviors in our environment while producing skills that we can use naturally. Of course, there is a positive experience to learning things in a rigorous environment. And for some people, they're going to want that. But for some people, like our PDA learners, persistent drive for autonomy, or some people refer as pathological demand avoidance, our PDA learners are not going to want to put up with a compliance to a demand. And so perhaps knowing those things, you can generally assume that they're not going to assent or consent to that, whether they speak or not. And again, these are values that apply to applied behavior analysis in order to examine individuals on their own lived experience and not the lived experience of everyone else. So if you have a learner who is obviously, able to verbalize their opinions and tell you exactly what they want and need, then you're taking their consent. If you have a learner that is not able to verbalize these things, you're going to always look for their assent and try your best to identify the assent, perhaps before you go and ask them a bunch of things that would already violate their assent. It's one of the things that is important in recognizing whether or not to do a FA, for instance. Shout out to my friends, Behavioral Observations, the podcast, if you guys know them. They recently did a whole thing on teaching people when and when not to do functional analysis, an FA. And, they say FA, they say functional analysis, but I like the term analog assessment better because it highlights the fact that it's old like a clock and, we don't need to use it all the time. And it's analog, basically. It's not digital. But no, it can be used for certain behaviors that are non-dangerous to observe. But of course, whenever there's a behavior that's dangerous to observe for the person or others, then it's appropriate to not do a functional analysis or an analog assessment when you're conducting an FBA or functional behavior assessment. There's lots of other methods that can be used. There's indirect assessments, there's interview-informed synthesized contingency analysis, and there's also just taking that person's word for it. You can just ask them, you know what I mean? Or ask their mom, right? And see if they agree, And you know what I mean? There's lots of ways to value somebody's assent at the start when coming up with things to help them, as opposed to retroactively by identifying what they didn't like after you did it. So you know what? I think this is a great time to circle back to the sensory room because I love the sensory room, Martin. And I think, it's amazing for, having a non-contingently reinforcing environment for kids at the age group. I think you said you had 3 to 6 going in.
Correct. 2 to 5 for now.
2 to 5.
Then Thursdays is ages 6 to 9.
Oh, excellent.
And yeah, so we are since this was our first day, we might at some point make it a little bigger potentially, but for now we're kind of keeping it a little small just to see like what goes right and what goes wrong, and see if there's any ways to, or see if there's anything that needs to be changed or not to make sure these kids have fun.
Amazing. And you know what? I'm glad you said it like that, because what could be more perfect to identify the assent and consent in the environment by starting off with something that you believe they're going to assent with based on what is generally the need for that population and who's signing up and what you think they're going
Yep.
to enjoy, and then trying to make sure that you honor that going forward, guaranteed, right? That's non-contingent reinforcement, that's HRE, that's everything we want in a sensory play. You know, we get to fulfill, finally, somebody gets to fulfill the sensory automatic functions of the behaviors for so many of these kids, which let's all take a second to bow our heads in shame that our society does not provide for anybody except for like skydiving in Disneyland, which is like super expensive. And you know what I'm saying? Like sensory
Yeah.
accommodation is great. Everybody likes a little bit of sensory accommodation in their own
Yeah.
way. And who didn't laugh when they were tickled as a child? Neurotypicals laugh. Did anyone know that? And did you know laughing is a sensory behavior? And if you don't like laughing, then you got other problems. You know, other problems. You know what I mean? Maybe think about why you don't like laughing. I don't want to put anybody down. If you don't like laughing, that's okay. And you know what? We know that you probably have a completely valid reason. Maybe laughing is unpleasant, and I'm sorry for saying that. But basically, sensory accommodation is not something that is unnecessary or needing to be joked about. It's something that we should ingrain for people in our society, no matter what, thereby producing a more neuro-inclusive environment for all. One of the things I'm so proud to be associated with is this sensory room you just opened up, Martin. So really congratulations, and congratulations to Corazone Care. And I don't know if you guys saw Martin cutting the ribbon, but really that was probably the highlight of my week, just watching you stand up there and, you know, clip that thing, because,
Yeah.
you know, open those sensory engagements, open the sensory room, and show everyone it's okay to have a completely indulgent experience for their sensory needs in a fun atmosphere. And how many social skills are there? I want to add before you go. How many social skills do you think they're going to be learning while having so much fun?
Right.
It's there for them, you know.
Yeah.
Go ahead, Martin. I'm sorry.
No, you're totally fine. I just want to say, you know, there should be more places that have sensory, so to be like sports stadiums, because we really want to see a more inclusive society and not have autistics feel left out, or like if they needed a break, like more of these should be open, because you know the rate's on the rise, of course, and we really don't want to feel left out. And I feel like with these rooms, we can not only recharge, but we could even be more aware of us giving assent. Like, because I know sometimes if we're tired or a little too hyper, we don't know that we are, you know, giving assent. And so it's like having sensory rooms could calm us down, and we could think about like, okay, let's know for, I should know for sure, like, do I give them that assent or not, you know? And
Totally. You know what? Sometimes we're just so tired, right? That we're just like, yeah, you sure, let's do it. You know, and we see that in ABA. Erica, Brice, you guys seen that before in your clients? Everything you ask them, yeah, whatever. Next, please. You know, what you guys see there, and back me up if you guys agree, but what you're seeing is the reinforcement is now shifted to all of the programming is negative reinforcement, and completing it is your only means to escape. So what I bring this out to say is that, when escape is now the motivation, for the behavior, even if it's a good behavior, unless you're escaping, like, escaping a hurt feeling in your bowel by, learning to go, do continence behavior or something like that. But like, if it's like a unconditioned thing that you're escaping, sure, there's no other way out. But you should never feel like your motivation is to escape something that is a conditioned reinforcer, right? But it's supposed to be a reinforcer, right? If you're trying to escape it, what is it? In reality, people don't see that it is both a negative reinforcer and a punisher. Why is it a punisher? Because when you escape, you have decreased the behavior that they were trying to produce. And what does that mean? When you implement a program and you could tell right away that someone's like, yeah, next, gosh, next, it's so boring, next. What does that mean? It means that the program you just implemented is an SDP, SD punisher, signal that you are going to punish them, regardless of how gentle it is. And this is, again, why it's so important to have Assent. It's so important to have an environment that you don't want to escape, and an environment that's reinforcing. I want to also clarify what's an environment that doesn't have any punishers but doesn't have any reinforcers, just blank. That's a timeout. Okay, do we want a timeout? No, no one wants a timeout. And sometimes we want privacy. Or is that a reinforcer? Yes. So if you think that sometimes people put people in a timeout, it's really what they want, right? Because they're like, oh my God, I just want to get away from them. You know what I mean? And we should be able to recognize that, because Assent has been out the window for a while in that case. Okay. So take them to the sensory room instead, huh? Ask them if they want to go there. That might be a great idea. They might be like, yeah, or ask them if they want to go to Sky Zone. You guys like Sky Zone? Brice, Erica, help me out. What are some places that your clients like that are sensory engaging?
Oh, that's such a good question, Brice. You got any off the top of your head?
The kitchen sink. So I live in Colorado, and wintertime I have, water play. Great sensory thing. I even as a kid, I can relate because I would go in the bathtub under the water and I would like play music, or I'd make a humming noise and I would go under the water and it would sound different, or like when you would plug your ears, and all great times. But I work with a 6-year-old learner, and she loves water play. But Colorado, wintertime, we're going to freeze. We're going to be ice cubes. And so that is a very, very, very highly preferred reinforcer. And so, I'm working with mom, like, what's a way that we can not have to increase your response effort of having to clean up, water all the time, or at least maybe, like mom will do anything for her child, of course, but how can we make this a little less watery, in your house, and then but also give the learner access to that. And so we found out that the kitchen sink was one of those places. What else? In Denver we have Meow Wolf, and I believe they do have sensory friendly evenings. Children's Hospital here as well, they do a lot of there's a program name for it. I'm just learning all of these things recently, so I'm forgetting what the program name is, but that's kind of a good thing that goes back to the medical considerations that you were talking about, Dan. Because it's important to go get your teeth cleaned. It's important to go to the doctor. These are one of those necessary evils, right? And I'm sure we have all worked with a learner where we're working on, decreasing the trauma related with that and trying to change our learning history. But they have a program where you can take your child in and they just get to play with the equipment. It's safe, right? They take away all the dangerous things, but they just get to play with the equipment and explore. And I think that's absolutely wonderful. And they don't do any medical procedures, so they get that exposure before. So that's a great sensory place. I know in Aurora, which is also in Denver, there's the Autism Community Store. I have not myself been yet, but I am dying to go because I love fidgets, and I'm like, I'll get myself some stuff. Really, and I mean, even if you can't go to like someplace big, I feel there's always a way. I do in-home services, right? And so I feel there's always a way that you can find sensory friendly things, find to go back to that Assent. And I really think Assent has a lot to do with maintaining rapport with our clients and building that trust and that bond and that relationship. I give Assent and consent, right, to somebody that I know I can trust, because and that you know, I know I can trust them because I know if I withdraw my Assent or my consent, they're going to honor that. And I think that's the big thing. And if we can, you know, as practitioners know, like, it is okay for us to have a day where we pair, or hey, this was a rough session, I need to take a step back and rebuild that rapport. And that goes a lot with, like, I'm kind of going off on 10 different tangents here, so stop me. I've been recently diagnosed with ADHD, so all of the thoughts have been going on and I'm trying to sit so patiently, and now my brain is like, you get to talk, go.
We wanted
But
to be honest. Go ahead.
yeah, you know, just all of this kind of really, you know, makes me think of cultural humility, right? And just how we kind of automatically assume the position of being, you know, humble and having that humility. We're going to make mistakes. I've made several mistakes already, you know, in my first year as a practitioner, but being okay with saying, I'm sorry. How can I do better? Let me try again, and taking a step back to just build that human relationship that I know we're all capable of. Take your white coat off for a second and just get down and get dirty and play with your learner. You know, I always make sure I set aside my laptop. You know, we're always doing work, and I make sure I set aside like 30, 45 minutes where I can just play, you know, with my client. Set it aside. Hey, let's just like play at the end of our session, end on a good note. That was a little rough. You know, we're doing some toileting. That's super aversive for everybody. Let's just take a step back. Let's play with some slime. Let's make pig noises. I'm going to do headstands, you know, whatever we need to do.
Yes,
Yeah.
yes, absolutely.
Yes.
And absolutely yes, yes to making pig noises and doing headstands and anything you can, really. What I love to do is I like to bring musical instruments too. I feel like behavior analysts, we can use instruments of music like doctors use a instrument like a stethoscope, you know. And if you guys are curious, what I mean is that it's easy to see if somebody is okay with that or not right away based on them just looking at it, at the thing, and either if they're curious or not to interact with it. You can easily tell. And then you can see how loud of a noise, you know, they tend to prefer, what pitch they tend to prefer. Maybe it might even help you learn how to speak with them better. And if they like it, you know, there's no better reinforcer sometimes than music for some people, if that's their special interest, especially. A music room on its own, you know, a music store where they let you play all the guitars. That's like pretty much, that was like a sensory environment for me when I was a child. I just spent all my time like going to the store and I saw just tune all their guitars and play them all. So I have an excuse to use all the fancy guitars. I'm just sampling that, but I tuned it for you guys. Like, please, like, don't kick me out of the store. I just waiting to be picked up. You know what I mean? But everybody can find a sensory thing they like, a sensory room for themselves that they enjoy. Some people like swimming. Some people like to just you know, listen to music in the shower, right? That's a sensory environment.
Singing in the car.
Singing in the
Yeah.
car, exactly. And I'll put the description below for that great sensory environment with the medical equipment and sort of the environment of doctors, because that's really going to help a lot of kids who are afraid of the doctors and, like you said, those necessary evils, right? That aren't actually evil, they're not so scary. They're
Right.
there to help us, right? Can be identified as not scary, there to help us be provided with Assent if we've already been up in their office blowing up their rubber gloves and having a grand old time. You know, if they let us do that, we trust them, I think, to help us out a little bit. And who hasn't been to the doctor with their kid and they did some like fun thing with the stethoscope or the rubber glove or the stickers or the little knocker thingy on the knee, you know, and they had to check out every single different little tool that was going to be used on them before it was used on them, almost like the kid is the doctor now, you know what I mean? So it's, or the adult, you know, I mean, people are curious.
Yeah.
Like, I don't want to say just kids because adults go to the doctor too and they still don't. I mean, I myself am like to the dentist, like, okay, well, how long are you gonna be sticking your hands in my mouth this time? You know what I mean? Who's
Yeah.
doing, you're the hygienist, and why? You know, why are you talking to me? I can't
Yeah.
talk, right now. You know what I mean? Right? It's necessary evil. They're talking to you, so you'll feel comfortable. But maybe if I just play with their stuff, in the office a little more, they can not talk to me so much. But you
so
know what?
true.
If you play with their stuff, I brush my teeth,
Yes.
take advantage of their resources, take advantage of their toothbrush and toothpaste. Erica, you know what you brought up recently for me was being a reflexive or reflective practitioner. Both are acceptable. And what that means is, like we've been talking about this whole episode, right, guys? Not just the sensory stuff, not just assent, not just consent, not just psychology and ABA, everything all together, everything we think and love and are passionate about, and need to now respond to as a society to create the world we can all accept going forward. Okay?
Yep.
That is what being a reflective and reflexive practitioner is about in my mind. I don't know what it means to you, Erica. I'd love for you to
Yeah.
elaborate.
I think you're spot on with that, Daniel. I think, it was funny. Lauren, my co-creator, and I, we got into it back and forth. Is it reflective or reflexive? They sound so much alike. And which one is it? And we kind of realized, it's actually both of those things. There's a ton of literature about reflective practice, which is really just the practitioner, the clinician's ability to kind of look back at that clinical interaction that they had. What went well? What didn't go so well? Why did I do the things that I did? What is the history of why I did the things that I did? We're going to do a cool series this week about some history in autism stuff that I'm really excited to dive into. When we think about our learning histories, when we think about our biases, our attitudes, when we kind of go back and reflect on all of those things, we're going to be better practitioners in the future. That reflexive, kind of like you were talking about with reflexes and the going to the doctor thing there a second ago, reflexive is when you actually are able to do that in the moment. So it's really just kind of a difference of time. Are you doing it after the fact, or are you doing it kind of in the process? And I think, as we go, my background, I've done a lot of musical theater, improv, all that kind of stuff in my history. And I so echo what Brice just said about you have to have rapport at the core of everything that you do. And to me, that's your yes and, right? When you're working with your, like you have to be number one yes ander to your client. And to what Martin said as well, with all the amazing stuff you're doing with the new place that you're opening right now too, it's like you have to keep in mind that accommodation for some really benefits all. So it's not just, it's not just like, oh, we're just having this, adaptive playground is like one of those great sensory areas. Those adaptive playgrounds benefit everyone. I've got an almost 3-year-old daughter, and she probably has the most fun when she's able to go to an inclusive for all setting, right? And
Awesome.
it's the same with like children's museums. All of those kinds of places can be those great sensory parts as well. But that reflection and reflexivity, those can really help us to be the best rapport builders we can be, which I think is huge in Assent.
Certainly, and I think what you're saying is clear. You have to be reflective to be reflexive, and similar to if you guys are like political science buffs or something, you have to start changing your practice to implement a new praxis, right? You know what I mean? We are in a paradigm shift right now in behavior analysis, and paradigm shift means that the entire metaphorical world of this field is turning, and we are changing, you guys. And for those who are critical of ABA, we know where you're coming from, actually, and we appreciate your patience while we figure it out, or we understand your lack thereof patience. It's not something that we take personally, because we are all trying to be reflective and reflexive at the current time. I think that's fair to say. Whether it is a model that is having Assent built into it from the literature of how the model is supposed to be run, or whether it is in your mind, in your values, in your Hippocratic oath that you honor somebody's Assent, you're being very reflective and creating a reflexive practice. And good job, you guys. More pets. Give yourself a big hug. Just have a great day. as a reward. Reward yourself somehow. Get some ice cream or some shave ice. I like to get out here in Hawaii. Martin, is there anything you
Yeah.
want to let everyone know about? I know this is a great month for us, and you have so
Yeah.
many things going on. We only touched on so few of them, but what
Yeah.
else would you like to talk about and let our audience know you have coming?
Before I do that, I do have one question I'd like to ask both of our guests.
Go for it.
It's hopefully it's when I wrote these questions down, my brain went really crazy. But how can therapists ensure the clients have the right to withdraw their assent at any time during therapy?
Brice, you wanna go first or second? I've got an idea.
I'll go second. You go for it.
Okay, absolutely. So I think first off, I think that needs to be just like plastered on every center, or the question the question
Mhm,
itself is an intervention in my mind, because
mhm,
when I think about consent, I think a lot of folks, when they think about consent, they think about dating, relationships, friendships, sexual relations. When we think about
right,
all those spectrums of relationships, right? What we
right.
want is active, enthusiastic consent. It's not
Yes.
enough
Mhm,
to just have like a sure, I'm fine being your friend. That's okay. Like we want somebody who really wants to hang out with us, really wants to go on a date with us. And I
mhm,
think that really the question you need to be asking yourself is what you just posed. You need to be kind of doing that throughout the session that you're
mhm,
working with that
mhm,
individual. You need to be, asking yourself, um, for me, it's when you kind of look back to all of the core features of how do you know that you're quote unquote paired with an individual. Like if you scoot
mhm,
close to them, are they scooting away? Or are they like, yeah, sure, I like you being near me? Or maybe they don't.
mhm,
Are they okay with the sound of your voice? Or does that make them
mhm,
shrink back? It's all of those non-vocal behaviors that y'all were referencing at the start of this too. You can
mhm,
read a million things going on by just looking at someone's body language, tone of voice, the way that their facial expressions are. So I think that's really what it is. I think you have to continually ask that. But what are your
mhm,
thoughts on that too, Brice?
Yeah, I think a lot of it goes with body language and nonverbals, making sure that we are just hyper aware of that. Martin, you were explaining earlier,
mhm,
is my learner screeching at me, or are they smiling and laughing? Are they throwing the
mhm,
Wii remote at my head, or are we dancing and singing?
mhm,
Personally, and bringing some ABA into this, have we operationally defined for our learner, and remember it's going to look different for each learner,
mhm,
what assent looks like for them? Have we
mhm,
defined what assent withdrawal looks like for them? And it might be a little hard because I feel this is always a changing behavior, right? Just like you mentioned, Erica, with relationships, no can take many different forms. But what we need to remember is if that person didn't say yes, if I don't have, and what I tell my RBTs is if you get that, I know this is not very operational, but if you get a weird gut feeling, like if you're still seeing yellow lights, that probably means that assent isn't there. If you're
mhm,
not sure, right, when in doubt, just don't do it. Err on the side
mhm,
of caution. And so making sure that, like, I don't know, I always kind of like direct people have like check-ins, like whatever, the hey, are you good, are we still good, like talking about sexual relationships, this is a huge thing, is
It's
like, is this
okay. Yeah.
okay, are we still good, do I still have a green light, cool, you like that, cool, let's keep going. We can still do that with our learners, right? And so I think, to answer your question, Martin, how we can allow for that withdrawal of assent at any time is we need to always make sure that the door is open for them to withdraw. I
mhm,
think sometimes for good, or just because we're so eager to help that we close those doors, oops, mistake, let's try not to do that again, is because we're so willing to help and we're just so excited. We're like, this, I'm a professional, I have a master's degree in this, PhD, whatever, I know what I'm doing, I got this is going to help you, this is going to be so cool, I'm so excited. Oops, I overstepped your assent.
mhm,
And
Mm.
so just being very, very humble, and being okay with humility, and just like checking in. I have this idea. I would like to try this. Are you receptive? Great.
mhm,
No, cool. I'm gonna step back.
Yes, yes, and yes, and by the way,
Yeah.
cultural humility and professional humility, are very important in these things. And like we said before, it's okay to apologize afterwards when you're
Yes.
debriefing. It's okay to validate your learners' emotions. What
Mhm.
Martin said was also very relevant in that, learners might actually not know when they're giving assent and when they aren't giving assent. They might actually just give assent without knowing it because they're so tired and be like, yeah, 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 just keep going, just whatever. But we don't want that. We want enthusiastic assent. If we don't have enthusiastic consent, during the dating atmosphere, and probably enthusiastic assent all the time too. You know what I mean? If we are not able to get that enthusiasm, like we really really want to be consenting or assenting to this. That's what that kind of means, the enthusiastic part. If that's not there, then should we be going forward? Probably not. We should wait until there's a more enthusiastic opportunity, or perhaps even find something different.
Mhm.
The example I gave of the Wiimote, I do want to clarify to people that perhaps, things might be getting thrown at you and assent might be withdrawn based on things you have no control of and have nothing to do with you. Does it mean, though, that assent wasn't withdrawn at a certain point? No, it still was. If there was some internal event that you don't understand and assent was withdrawn, it's a good idea to see whether that enthusiasm has faded. The learner might still look like they're okay with finishing out the session, but they might really not be okay with it. You know what I mean? And if you can tell that they're probably actually just humoring you. Um, Again, objects might be thrown. People might snap. You know what I mean? People don't want to humor something forever, and especially if it's not ending quickly enough for them as well. So again, enthusiastic assent. If we need to take a break, we're taking a break. Okay, what I mean? Enthusiastic assent.
Mhm.
If you're not happy, relaxed, engaged, visibly or audibly or indicatively in any sort of way, if you're not all three of those things, then let's not practice a intense social program or skill-based learning or task analysis that might be
Right.
several steps. Let's not do that. At most, let's practice a leisure skill or something cool. Something that will maybe bring us back to that state. Or perhaps just give time. Time
Yeah.
and space is okay. And like we said before, it's not always a timeout. Sometimes people are just like, I really just wanted out of that situation. Then that becomes a reinforcer. But again, you have to know if somebody's assenting enthusiastically to a timeout, actually that's a sign that that's what they want is just some space, and that would be a reinforcer for them.
Okay.
So what I mean by assenting enthusiastically, we don't even necessarily have that in the science yet, but let's define it for the audience. Okay, enthusiastic consent. You want to consent. You're happy to consent. It's visibly clear that you probably have assent and consent at the same time with enthusiastic consent. Enthusiastic assent. Assent is kind of either based on verbal or body language or your behaviors. I would say if your behaviors are not showing HRE, then you no longer have enthusiasm. You may have assent, you may be going along with it. If you're not happy, relaxed, engaged, as Dr. Hanley says, you're not in a space to learn. So that's where I would define it. And I know a lot of models are implementing assent as a definition that clearly defines parts of their treatment plans. And I'd like to see more of that. I'd like to see more things going up to make sure that it's there for all learners, right? That we recognize, maybe we have it plastered on the wall. We recognize that they are not, giving assent at certain times, what to do, and where to go, what might be enjoyable for that person instead of something that potentially put a damper on them because they had to remove their assent, which really is, what is that? A permanent product that something did not go right, or it was aversive, right? It doesn't have to go wrong to be aversive. It could go right and still be aversive, I guess, is what I'm trying to say. Before we go on too many tangents, too, I know we're all tending to do that, today, but I want to circle it back to you, Martin. I know you had a lot of exciting stuff to talk about. So open it up, and we're really excited for the rest of Autism Acceptance Month, and
Yeah.
it's been on fire lately.
Yeah. Definitely. I've been invited to be a guest instructor at Santa Clara University tomorrow, or Monday, I should say. I totally forgot today is Saturday. So yes, Monday I'm going to be teaching at Santa Clara University. Let's see what else. I have 3 speaking engagements lined up after that. I have another online talk with people in Dubai, and that will be online. But also Saturday is my first Special Olympics competition. So I'm excited about that, but I'm also nervous because I've never really participated in a team sport before. So it's going to be something incredible. But
Oh, you're gonna do great, Mike. You know, I've seen you work out. You're in top shape too. I'm excited. I'm excited, honestly. I'm sure
yeah,
you're gonna be well, impressed with yourself as well. Martin, if you guys don't know him personally, he's like the perfect example of humility. He's the most humble author, business owner, activist, college student, clinician, um, political figure, athlete, and lecturer at a college level that you'll ever meet. He really is, and he's the youngest too. So we got to give it to him. He's very humble among all those other things. And I always run out of fingers when I try to count Martin's achievements, but I'm sure that he is inspiring to a lot of people. I know, Martin, I know you. I know your mom is proud of you. You know what I mean? And she is. Shout out to your mom, by the way. She's the co-author of your book, and you always talk about how much, her respect and admiration for what you're doing means, and how she helps you so much. But everybody, around here who has benefited from you, including myself, hearing your perspective and hearing how ABA can help you be that hero and how you can take it upon yourself to make sure that you're there for somebody in the right ways that support them. All that stuff is so inspiring to us all, and we all really, really respect you for it. And so, congratulations. Your sensory room. I wanted to give a shout out to Starbright community, and I also wanted to highlight your event in Houston coming up later in the year. Do you want to tell us a little more about that?
Yeah, if I could load up the photo here real quick. It's a 3-day retreat in Texas. So there's going to be collaboration with neurodiverse speakers, presenters, neurodiverse business owners, and it's what Starbright community is doing is honestly awesome, like gathering a lot of people together and really have each other collaborate. I think collaboration is something that we need if you want to start seeing a more inclusive world.
Yes, shaka to that, right, Brice? Absolutely. Collaboration is key. And, on the note of collaboration, I really wanted to make sure I open the floor to you as well, Erica. Is there anything education-wise or clinical-wise that we can look forward to as an audience?
Yeah, Lauren and I are actually going to be presenting at ABAI. We're going to be doing a symposium. I believe it's called What Skinner Could Have Learned from Freud. So it's it's a very scintillating title, but we are presenting that on the Saturday at ABAI with another one of our co-authors who's also named Lauren as well. So we are looking forward to that. We are also planning a Critical Friends of ABA mixer that's going to be coming up that same week in Philadelphia, that Friday before our talk as well. We'll be sending out some info on that. And then our book is in production. So Psychology Essentials for Behavior Analysts will be coming out later this year. As soon as we get a date, we will kind of let our followers know. So if that's something you're interested in, we're just kind of feeling our way through this and really happy to share those things.
Yeah, awesome. And shout out to our hashtag Critical Friends of ABA.
Yeah.
You guys looking on your Instagrams. A lot of really hardworking individuals in that group who, of course, we are critical of things, but we're friends of the field. We're trying our best to preserve it for a brighter future with best practices that promote, the values people need to gain the support that is necessary from their loved ones, their society, their insurance provider, whatever, what have you, right? If you guys are looking at hashtag critical friends, shout out to Bearded Behaviorist, ABA in the Wild, Dr. Shelby Dorsey, Dr. Shane T. Spiker. A lot of our friends, honestly, are part of that Integrated Behaviors, Integrated BX on Instagram. If you guys follow her as well. Of course, this is how I met Brice. Do follow the Psychobabble BCBAs and the ABA Unicorn as well. Support their efforts. One last thing I wanted to talk about, because you did it to me, Erica. You brought up Freud, and you probably shouldn't have, because I literally just watched Freud's last session on Netflix, and I was like, all right, what a great morning for me.
I have to watch it.
Wake up and watch Freud's last session for some reason. I know it's a play, so maybe as a theater aficionado, you appreciate that one as well. I actually used to have these slippers with Freud's tongue come out, and they're called Freudian slippers. And unfortunately, they're ruined because I overwore them. But the point of this was not that Sigmund Freud is so great or anything like that, but if you guys look into the work of his daughter, Anna Freud, the reason I really want to bring her up is Anna Freud is basically the founder, or you could call her the mother of child psychology, child psychoanalysis, actually. And something she said in the movie, which I thought was very, true, but also something that I think is important for a lot of child psychologists, and, feel free to chime in here, Erica, is that, especially in the time in World War II, during that play where it's set, she said that when the violence of the war meets the violence inside the child, that's where the real danger is. Meaning that creating people who are violent is actually ultimately in the future far more dangerous than the violence itself that they're observing. To bring it back to what we're talking about today, the violence, and let's not call it violence for the sake of this discussion. Let's just call it the lack of assent. When perhaps the violations in services of applied behavior analysis of assent, when those violations of assent meet the child's innate ability to violate someone else's assent, that is where the real danger lies. Okay, so we're saying, a lot of people are worried, what if we reinforce a problem behavior? What if we back off too early and they think that hitting is the best way? Actually, there's a lot of data to suggest that if you back off during the precursors warning to those behaviors, especially, you back off by acknowledging this person's feelings, empathizing, that form of praise is not sufficient reinforcer to maintain a significantly difficult behavior to do, like punching or kicking or throwing or hurting or running or screaming or crying or biting or spitting. Wow, that was a lot of behaviors. But these are all the things people are worried about, and you don't have to be worried if the violations of assent of the treatment never meet the child's ability in their mind to violate your assent. And so if you ever felt violated and you thought that something was in spite of you, understand that you really have no reason to feel that was personal, and none of these behaviors are in spite, but perhaps the feelings of unsatisfaction are resulting in extinction, and this is all occurring internally. So they say radical behaviorism, and behaviorists don't consider what you're thinking, and we do. We just we have to go through several steps to get there, and they are well worth going through, my friends, my critical friends of ABA. So we'll leave it out on that note. I want everybody to have a wonderful rest of your weekend. If you're out in Morgan Hill, go to Martin's Sensory Room with your kids.
Yep.
Have a blast.
Just some keynotes real quick about the Corazone Care sensory area.
Mm-hmm.
It is at the Morgan Hill Centennial Recreational Center. For now, we're starting it at a younger age, so Saturdays from 8:30 to 11:30 for ages 2 to 5, and then Thursdays 5:30 to 7:30 for ages 6 to 9. We're going to start off a little small just to see what we can do and then see if we could expand the ages and hours. And on that note,
spend the weekend reflecting and come back on Monday reflexing. Okay?
yeah,
So
there we
pat
go.
yourself on the back for listening. We'll see you guys next week. Aloha, mahalos.
2, 3.
Yay!